Hello everyone. Welcome back to the course on rodent neural experiments for neural engineering. So from the last session we are dealing with the anesthesia aspects of the rodent surgery, which is equally important. Um, for that matter, this knowledge can be useful for any surgeries which requires long term monitoring of the vitals and long term administration of the anesthesia. So in last session we covered all the basic principles and definitions and abbreviations and the dosages and all that. So in this session we will try and look at what are all the equipments that are required, which in a way it is a bit expensive, but then as I said, as I emphasized, it is worthwhile and it is a one time investment as well. So we'll go through the equipments that are really important for the anesthesia administration, and then the important aspect of the vital monitoring and how exactly these drugs are handled. All right, so these are the outline. We've covered the definition, abbreviation, and the pre-anesthetic evaluation and pre-anesthetic care and preparation as to how we would select an animal and what are the scoring system for body conditioning, how to make out whether your subject is healthy or not, so that your experimental outcomes are met as expected. So for today's session I broadly cover general anesthesia equipments and how the inhalational part of the administration is and the injectable anesthesia, and in the next session we will cover the remaining aspects of vital monitoring and post-operative care. So coming to the materials and equipment, which is a very important aspect, and we need to know what each and every aspect of the equipments plays a big role in and how it plays a big role in the administration of anesthesia and monitoring of the vitals and the disadvantages and disadvantages. So broadly these are all the equipments that are required, and you can actually go to even higher extent, but then these are some of the basics of the apparatus, minimal apparatus that are required. So obviously the first one is all the general materials, where the warm water circulating pad, or if you have a electronic warmer, that is fine, or heating disc or pad, or even the gauze pads. So those are some of the equipments required to conserve the body heat. So we will come to the body temperature aspect of it when we discuss the vital monitoring and what role it plays. I did introduce the concept of hypothermia and the possible issues arising from it. And the other important aspect is that the eyes should be kept closed and it should be moist, so that the cornea of the eye doesn't get dried. So ophthalmic ointment is also pretty important. So in the gas anesthesia machine is the major component of the general anesthesia endeavor, with adequate gas scavenging system or filter. So that is very important to understand. So I guess last time we did cover a bit of this scavenging system. All right. So what it does is, whenever the rat inhales the anesthetic gas, there is some amount of gas which is expelled from the circuit. So that has to be removed from the atmospheric air to prevent inhalation by the lab personnel. That is very, very important. All right. So to remove that air, you need to have this scavenging system or filter, which is a canister that is shown here. All right. So that's very important. And then you have the induction chamber, which is constructed of a see-through material or glass or polycarbonate. So before we transfer the animal into the stereotactic apparatus or the surgical system where the actual tubing of the anesthesia delivery machine is installed, you need to have an induction chamber where the induction of anesthesia happens. The term induction is the onset of action of these anesthetic gases on the central nervous system. All right. So when you actually put the rat to the unconscious state, that is where the process of induction comes in. All right. It basically means it's a first delivery of the anesthetic gases where the rat is sedated or rat is put to unconsciousness, and then you will transfer the rat where the maintenance of the anesthesia happens in the surgical apparatus where the gas delivery is assembled. All right. So induction is the first part, maintenance is the second part. That is very important to understand. All right. So that's another important component. Then obviously you will have a lot of sterile isotonic saline or sterile water for injection, then crushed ice or ice pack, which is optional, and then the gloves of course for surgery and handling of the animals. All right. So these are the basic equipments that are required. So when it comes to inhalant anesthesia setup, which is the workhorse of the entire workflow of the anesthesia, general anesthesia, you have two types of delivery. One is high flow delivery, another one is low flow delivery. So we will come to the details of it. So this is the traditional vaporizer where there is a high pressure and high flow gases which passes through the tubing, and here you have a low flow. So the difference is that the standard procedure will have a set flow rate in this high flow vaporizer to minimum of 500 ml per minute, and that is important to know. The range is up to 1000 ml per minute, which is the flow rate, and the way it is calculated is 1.5 to 2 into minute volume, which is calculated as per the body weight of the rat. For example, in a mouse which weighs around 30 grams, you need 26 ml per minute delivery, and that would come to approximately twice that would go for 50 to 60 ml per minute. All right. So when you look at the minimum rate in this high flow vaporizer, it is 500. So obviously this sort of vaporizer is used only for rats, and it is not compatible for the recommended flow rate of mice. All right. That is an important thing to notice here. If your experiment involves mice, then this sort of big style vaporizer where there is a direct high pressure where the liquid is converted into gas and with a high flow of 500 to 1000 ml per minute is not useful if your subject in the experiment is mouse and not rat, and this sort of vaporizer is always rat and above. So what do you do for the small animals? So that is something like mice. This uses this is basically the syringe driven digital vaporizer where the drug is loaded in the syringe rather than the canister. All right. So and digitally this is driven where this is turned into a gas with a minimal pressure as compared to the high pressure wick style vaporizer. The drug is loaded into the syringe, and this sort of vaporizer is used for small animals, and it uses room air or compressed gas, unlike the wick style, and it uses small amounts of liquid anesthetic. That is another huge difference, and it produces undetectable amounts of waste anesthesia gas. So here even if there is no scavenger, we can sort of manage because the waste anesthetic gas is negligible unlike the high flow, and it delivers pretty precise amounts of anesthesia, and This is useful if your delivery is only 0.3 to 0.5 ml per hour of isoflurane on a 30 gram mouse. Okay, and flow rate as low as 25 ml per minute can be achieved with this sort of digital vaporizer. So these are some of the specifics that you need to remember before choosing your anesthetic setup for the experiment. Alright, so that's very important to understand. And I hope you all remember that these are all the setups which are used only for gaseous anesthetic agent like isoflurane and sevoflurane. Okay. We will not be using the drug ketamine and xylazine, which are predominantly injectable. They are only injectable, it is not predominantly. Always ketamine and xylazine are injectable anesthetic, isoflurane and sevoflurane are inhalational anesthetic. So this is the workflow in a nutshell, and an example of somnosuite system has been used by the company Keto. So, but then this is how by and large the entire workflow of the general anesthesia works in a low airflow, low flow vaporizers. Alright. So, as I said, the first step is to place the rat. Of course, before this you will go through the process of selecting the animal for the surgery, ruling out all the disease conditions, selecting the healthiest of the subject. Once all those preliminary workup is done, you will try and let the rat acclimatize to the chamber for initial 2 to 3 days. Then only you are trying to consider the animal for the anesthetic workflow, provided all your surgical setup are ready. Only then you will actually begin the anesthetic process, and it is not other way around, as I explained earlier. So you will place the animal in the induction chamber, which can be even an acrylic box or glass or polycarbonate, wherein there is inlet and outlet. Alright. So the inlet actually delivers the gas for the first time, where the rat inhales it and then goes to an unconscious state. So that depends on the onset of action of that particular drug, and then depends on the body weight of the rat. Alright. So once that induction happens, then you are trying to switch to the actual behavioral setup or the experimental platform where the surgery will be performed. So everywhere you see there is an outlet provided whenever there is an inlet. It does both scavenging, and then this is the scavenger board, a system where the extra anesthetic gases are removed from the circulation, and that is being let out as the waste. Okay, and it uses room air to create the flow rate and to maintain the flow rate. That is in a nutshell how the anesthetic flow works. And before that, obviously you will be loading the drug into the syringe, which is digitally driven with a precise set flow rate. Alright. So these are the different sizes where the induction chamber is available, and this is how it would look like. So it affects the time required to induce the animal as well as the user's exposure. That is very important to understand. So the smaller the size, it may hold a small amount of anesthetic gas, and it might take a longer time to induce the rat. But it is a very important component that you need to have an induction chamber, always good to have an induction chamber. So now another major apparatus that is to be checked is the delivery system. How do you sort of deliver the anesthetic gas to the rat? There are various techniques, but the preferred one is to have a cone. which is anesthetic mask, and this also comes in different sizes, and choose an appropriate size depending on the size of the rodent that you are planning to use. And this will help to reduce the staph exposure along with the scavenger system, because the gas flows directly into the nostril of the rat, and it also maintains the animal's plane of anesthesia with a constant flow rate is maintained, and the distance is important. Alright. So, that is how the size is maintained. There should be a significant distance between the nostril and the delivery system to prevent excessive wastage. Alright. So, that is how the system works. The inflow happens along with oxygen, which is a major attractive feature of all the inhalation anesthesia, where oxygen is delivered along with the anesthetic gases, and the excess gas gets scavenged out. Alright. So, along with this, these are all the monitoring system. You will monitor the rectal temperature, you will give the fluid intake through the intravenous catheter if the surgery is long, or if there are signs of dehydration. For that matter, any surgery is always better to have an intravenous access through which an isotonic saline can be given, and the temperature and oxygen saturations are all monitored. Alright. So, it is always good to have this anesthetic, proper fitting anesthetic mask along with the general anesthesia equipments. Next, another method of delivery is the stereotactic anesthetic mask. If your surgery is going to be on the brain or on the spine, this is cervical cord, this gives a very smooth anesthesia if you have this sort of a setup which is fitted into the stereotactic apparatus. If you all remember from the previous classes, these are all the nose bar and jaw bar section of the stereotactic apparatus. So, right in front of it, the nostril or the nose of the rodent goes and fits in snugly where the anesthetic gas and the oxygen is delivered. Alright. These are the different ways of using it. So, this is where the nose goes, and then the nose bar and the jaw bar is used for rigid fixation. So, this is another modification which is generally recommended for all your neural experiments, to use the stereotactic anesthetic mask, which does not take up extra space. Not only that, it gives a very good maintenance of the anesthesia throughout the procedure. As I said, when you are using injectable anesthesia, if the rat is fixed rigidly onto the stereotactic frame, you literally have to lift the hand paw and find the intraperitoneal space and inject it, which is very cumbersome, and you may not really hit the intraperitoneal rate if you are a beginner. So, and then the rat wakes up, and it is very difficult when the rat comes off the fixation points of ear bars. Alright. So, it really damages the brain, and it probably even damages the implants. So, it is always good to have the stereotactic anesthetic mask and the entire system built into the stereotactic apparatus. So, as I said, in the inhalation anesthesia, a non-flammable liquid will be administered by vaporizing it into a usable gas, and that is the precision vaporizer in a low flow system. Alright. So, for induction, the mousetrap is placed in the anesthetic chamber, and a mixture of oxygen, which is 2 to 3 liter per minute for rat, and isoflurane, which is a 4%, is pumped into the chamber from the vaporizer. Alright. This we have gone through it already. So, then the animal is anesthetized within 1 to 2 minutes. That is the usual duration for onset of action, by which time the rat is usually put into sleep or unconscious state. Then the animal is removed from the chamber. So, this is the induction chamber, and then you transfer it to the stereotactic apparatus. Alright. And if anything need to be maintained, which in case most of the time we will be using, if it is around more than 15 to 20 minutes your surgery is prolonged, then it is always better to use the anesthesia, and then they can be maintained using face or nose mask with isoflurane 1 to 2.5%, and oxygen should be maintained at 0.5 to 1 liter per minute. So all these flow rates, dosages, and the strength of the drugs, all these has to be noted, and these has to be used. These have to be used appropriately. All right. Any difference in the mixture, any shortcoming in the flow rate does affect the oxygenation of the rat, and that proves detrimental to the rodent's life. All right. So that's how, in a nutshell, the inhalation anesthesia is maintained. So this slide, I'm trying to explain the role of MAC. This is a very important parameter when you are considering the general anesthesia. It refers to the minimum alveolar concentration, wherein 50% of the animals lose a motor response to a noxious stimulus, and that motor response is when you pinch the hind paw, usually there is a withdrawal reflex. All right. So when you pinch the hind paw, there is a withdrawal flexion. All right. So that means the rat is still active and is able to perceive the painful stimuli. So the MAC refers to the minimum alveolar concentration. If you all remember, the alveoli for the respiratory system, that is the organ of lungs, where the trachea becomes bronchi, principal bronchi, secondary, tertiary, then small bronchioles, multiple bronchioles, and then comes the alveoli. That is the end unit of the respiratory system where the gaseous exchange happens. So it is the concentration of the anesthetic gas which flows down and reaches the alveoli where the gas exchange is happening. So the minimum concentration of that gas in the alveoli, which will sedate or lose, and which will make the animals, 50% of animals lose the motor response. That motor response is withdrawal reflex. That is the concept of minimal alveolar concentration. So when you check that, it's different for different aspect of the cerebral function. For example, if it is just say blunted autonomic reflexes, if it is about loss of motor response, consciousness, loss of memory. So this is how the plane of anesthesia becomes deeper and deeper. Initially it is just about memory of the events, then it loses consciousness, then it loses the motor response to a noxious stimuli, and even the autonomic function like heart rate, respiratory rate, all this will get blunted, which is a dangerous level of anesthesia. All right. Generally we stop at that, where there should not be any motor response for noxious stimuli. And what is the change that is happening? Increase in the MAC value from 0.25 to 1.5. So as the MAC value keep increasing, the plane becomes deeper and deeper from loss of memory to blunted autonomic reflexes. And if you see the vaporizer dial setting, the concentration of the gas that are used in vaporizer is also going up. It's starting from 0.3 to 0.5% required for loss of memory. It goes up to 2 to 2.7% for blunted autonomic reflex. So this is the preferred setting, 1.3 to 1.8% of vaporizer dial setting, which will only lead to loss of motor response to a noxious stimuli. And these are the various parameters that can be looked at, where the cerebral function, spinal reflex are anesthetized, but autonomic reflexes are intact. So this is important. Whenever the blood pressure falls, the heart rate increases. We need that autonomic reflex, all right, not only to pick up that there is something going wrong with the blood pressure, but it also sort of compensates on its own autonomically. That is what the word autonomic means. Automatically the body switches to a higher heart rate when the blood pressure falls. That is the autonomic reflex which need to be maintained throughout the surgery. So, but then you can sort of bring the heart rate down if you can replace the volume with either isotonic fluid or for that matter even the blood itself, alright. So, that is what is importance of the minimal alveolar concentration. So, briefly about the most common drug that is used for inhalational anesthesia. So, as you all remember, that is the method of delivery, and the animal needs to be placed in the clear walled induction chamber. Then you will turn the airflow to a level of 0.8 to 1.5 ml per minute, which will have 3 to 5% of isoflurane. That is the dosage, alright. And then for a continued delivery, this is for induction, this is for the maintenance. For maintenance via the nose cones which are in the stereotactic apparatus, you will reduce the airflow to 0.4 to 0.8 ml per minute, and the concentration will also come down to 2 to 2.5%, while the monitoring for continued loss of reflexes along with sustained steady tidal respiration. That is very important. You need to look for the motor reflex, not autonomic reflex, motor reflex. If for example, with 2.5% itself the rat is losing the respiration, it is losing the blood pressure which are the vitals, then immediately the concentration should be reduced to bring down the MAC, as I explained in the previous slide. So, it is very important that vital monitoring goes in parallel with the maintenance aspect of the anesthesia. Only then your entire experiment goes smoothly, alright. So, which we will discuss it in detail in next few slides. So, these are the commonly used injectable general anesthetic drug. The most common and the favorite drug combination is ketamine and xylazine, and the dose is 90 to 120 milligram per kg, 10 milligram per kg of xylazine. It can be given IP and or IM. If you all remember from the abbreviation that we discussed, it is intraperitoneal or intramuscular. Generally we use intraperitoneal route for inducing these anesthesia. So, these are the other drugs, which is dexmedetomidine, which is used along with ketamine, or you can add acetylpromazine or pentobarbital, acetylpromazine again, diazepam and xylazine. So, these are for sedation, that is to put to sleep, however, where put to sleep where the animal is calm and relaxed, alright, but not unconscious. It is conscious, it will perceive the pain. So, this maybe is preferred for positioning stage in or to put the rat in the induction chamber, or if the animal is too wild and violent and not cooperative, for a smaller procedure like drawing a blood or giving an injection, then only these sedative drugs are used, alright, where only sleep is induced but the consciousness is intact, alright. So, these are some of the drugs. So, injectable anesthetic is most commonly used if the required anesthesia time is only around 20 to 30 minutes. If it is anything beyond that, then it has to be either topped with repeat injections, or you will have to use the inhalational anesthesia, alright. So, the problem with this injectable anesthetic is that it is pretty unpredictable. I think we gone through the disadvantages of injectable anesthesia in the last session, and that is one of the most important aspect, where it is unpredictable and it can have its effects on the vital parameters, which is also unpredictable, alright, where it can suppress the heart rate and bring down the blood pressure, it can raise the intracranial pressure. So, these are some of the side effects, and the major difficulty is that if the rat is fixed to the stereotactic apparatus, to use this a site to repeat the dosages is a big hassle and is a really cumbersome procedure to repeat it again and again. And then those effects will vary from one injection to another injection. Okay. So, how do we prepare this particular combination of ketamine and xylazine? And it is a very good combination of drug if the procedure is only around 20 to 30 minutes, because the entire preparation for the inhalation anesthesia is huge, and if you really do not have the setup for general anesthesia, this is one thing which can be used as a last resort, especially if your procedure is only going to last for 15 to 20 minutes preferably. So, this is how it is prepared in a sterile 10 ml bottle with a rubber stopper. You need to mix 1 ml of ketamine with 0.1 ml of xylazine, and then you will mix it with 8.9 ml of sterile water, and you need to label it. This is very, very important, because if at all you are using isotonic saline injection and if you do not label it, you will sort of switch the medicine and you will give this beyond the recommended dosage and the rat dies instantaneously. So, it is very important to label all the drugs that are used in the anesthetic apparatus, or for that matter in your entire surgical endeavor. And generally the dose for mounts is 0.1 ml per 10 gram of this mixture. Alright, first you need to prepare this mixture, and then you will use 0.1 ml per 10 gram, preferably intraperitoneally. Alright, for us comparatively smooth anesthetic properties, you need to use it intraperitoneally. For a rat, you will be using 0.05 to 0.1 ml per 100 grams intraperitoneally, and you can use 0.1 ml per 100 gram body weight intramuscularly as well. Alright, and obviously you will be using these ophthalmic ointment before you begin the procedure. So, that is the end of the all the drugs that are used in the anesthesia, both injectable and inhalational, and these are all the equipments that are used, and these are the minimal requirement for the general anesthesia usage, without which your setup is going to be compromised and you will endanger the life of the rodent if any of these apparatus are lacking. And if it is really expensive and if you can't afford, ketamine xylazine is the wonderful combination of injectable anesthesia and especially if your procedure is a short one lasting for around 20 to 30 minutes. So, let us look at the other aspects of the anesthesia, especially the vital monitoring and postoperative care, which are equally important in the next session. Thank you.